truly appreciate that we get to share some research with you, that we get to partner with you. Like Katrina said, I bridge multiple worlds. I live in practice. We do gigantic projects. I teach in academia. And I'm the most privileged, I think, to be executive director of the Center for Advanced Design Research and Evaluation, which is a nonprofit that brings these worlds together. What we're going to talk about, very briefly, because we only have a little bit of time, is about resilient access to social connection for lower-income older adults. I sat next to the Zarina of safety, which is just how you're always going to be known now, Katrina, I'm sorry. But it was tough. 2020 was tough. We understood that social connection was vital. We have always understood it. But it was held hostage during the pandemic. And so the study was birthed during the pandemic, talking about how we get social connection in a safe way to older adults who are lower income and are living in affordable environments that PVM does provide. The team is vast. My co-PI, Dr. Maggie Calkins, a well-known gerontologist, is not here with me today. There's a large team, but you do have on your tables like an executive summary of the report, so you can see it, and I stand on the shoulders of giants in the findings that I'm sharing. This we know, the number of older adults feeling socially isolated more than doubled in the pandemic. What Dr. Grady just said, impacts on blood pressure, heart disease, immunity, stress, anxiety, and cognitive function when we were talking about cognitive decline. And our prompt was very simple. How do you design affordable housing environments for older adults to improve social connection while being resilient to infectious disease outbreaks? How do you take those two seemingly competing priorities and then achieve them in an affordable way? It's a really, really simple prompt. Brian mentioned the Hard 202 toolkit that seeks out projects that support social health of older adults. We use that as a starting point. And I'll read out a particular section in the toolkit that talks about health and wellness criteria. Building design that promotes physical activity and social interaction, improves health, mitigates the effects of loneliness in an aging population. Building design can effectively mitigate the spread of infectious diseases. In the end, we have food, water, air, and shelter. And oftentimes, we don't pay enough attention to shelter, and all of that is put together with this ecosystem of love and care that we've talked about all morning. But the built environment is one of the things that could be your best friend in these goals you've set for yourself. And oftentimes, we are not fully tapping that potential, and that's what we're really here to talk about. So again, not only did we want to set design criteria, but prioritize design criteria, because if you only have $100, what do you spend it on? Right? On what? Sorry? Necessities, right? Okay, so I'm actually glad you said that. What is a necessity for social connection? And is social connection a necessity? Right? So if we agree as a group that social connection is a necessity, are we designing our environments to promote that necessity in a safe way? Right? And I love that there were a few no's in the room, and it's not because of lack of intent. It's because you have so many competing priorities every time you're putting a building together with very, very limited resources. So that's what we were trying to get to the heart of. We started off with saying no good work can be or should be done alone. So we started with creating a coalition with HKS, the Retirement Research Foundation that gave us a grant, PVM, Salk Institute, Mass Design, Communities Care, and these were all the people we brought together to do this work. We created a coalition that CADRE managed. We went in, looked at the literature. We engaged stakeholders from 2 of your villages. We engaged experts who told us why a lot of what we could do would work or wouldn't work. And then we gave a report out, which is what I'm doing right now in the next 6 minutes. But that, again, is not too complicated, right? It's a very simple process. It becomes simpler when you get the right people to do the work. First of all, we wanted to tell you that in the 2 PVM villages, St. Martha's and Woodbridge, our findings from the survey that we did, which was part of that stakeholder engagement, we did surveys and focus groups, we had gone in thinking that they would be extremely isolated and lonely, and that is not the case. The satisfaction with life scale for both the sites was actually in the satisfied range, and I would tell you probably much higher than what you would find in a lot of more higher income, independent senior living. So there was something there that I thought was really, really interesting. Part of it was because of a lot of the programs that were put in place. Tom was there at the time who had talked about a lot of things he had done. And part of it was just the community that was in place. Companionship was high, and on the loneliness scale, residents in both sites tended towards least lonely range. So that is kudos to everything that the system did. And it's the human connection that worked with the environment. And so the question we started asking ourselves was, did the environment support this intent? What were the spaces that they were using? The community room and the lobby. These were the 2 most common spaces. Doesn't surprise us. But what's also interesting is those who more frequently used the community room also said they felt more improved companionship. So bring people out of their rooms and bring them into the community spaces, because there's data that shows that that makes a difference. Residents use spaces when they have more programming. They have to have space to socially distance. There you go, Katrina. Easy to access, center of social activity, ability to personalize, and then a lot about light, getting outside, and really being able to either see outside or get there directly. And we know outdoor spaces became a premium during the pandemic. What spaces do residents feel safe in? Again, accessible walkways that are close to the building, they are visible, that are close to social activity, have a lot of seating, have defined outdoor areas, and provide protection from elements. Not rocket science. They're really, really simple. Specifically, what spaces are used most, we looked at that. Individual apartments actually are not used a lot, especially during the pandemic. Lobbies, outdoor spaces, and community rooms. But what we found was really fascinating is the use of the hallway. The connector spaces. That's where a lot of magic was happening. Right? So it's interesting. You think about it, say, yeah, that makes sense. And so it's something that we haven't explored enough from the design standpoint. One big idea that came up, a space we'd never thought about, was the laundry room, right? Everybody spends time in the laundry room. What would happen if the laundry room now had like a few windows and actually had a better amenity? Because that's where you come. You make your organic social connections there. So sometimes big ideas come from really, really small things that we can do today. How do we prioritize? What type of spaces are most important that promote safe social connection, and what give you the most bang for the buck? So we were again saying, okay, how do we make this real? We know all of these things are important. What's most important? And we did this ranking exercise. We did it with experts. So Brian was part of that group. Roger was part of this group. We had a lot of people. We had someone from HUD who joined us. And we did almost like an eye test with them, where instead of saying take 10 things and rank all of them, we said A and B, those are your only choices. You know how a doctor does an eye test? They had to do 4 choices, A or B, which is more important, B or C, which is more important, C or D, which is more important. And that's how we came up with the ranking, which was a lot of fun. And we did that with the experts. And again, from that overall list, ventilation, comfortable seating, convenient location, outdoor areas, et cetera, we asked them to rank during a pandemic and during normal times. And then we put those 2 together. So imagine there is a pandemic. Imagine these are normal times. We did them with experts. We did that with your residents. And this is where we landed, that for residents, during a pandemic, social distancing, of course, was really important, but ventilation went to the top. And during normal times, comfortable seating options were really important. But what is common in both is access to outdoor areas and ventilation. That's really, really simple things. And again, for the stakeholders, you can see seating, social distancing, and ventilation. And that's what we landed up saying, okay, here are some low-hanging fruits. Outdoor patios. It's such a small thing, but it's an in-between space. And you could do a lot with a patio. And that came up again and again, as did community rooms that have access. How do you activate them? What will you do in those spaces? You can see that in the report. Exercise, chatting, walking. During the pandemic, exercise really went down, because they couldn't get outside to exercise and they stopped using the gyms. And we know the trickle-down effect from physical health to mental health to cognitive health. So again, keeping in mind that what would we do so that they have access to outdoor space and can stay active? Of course, your barriers are funding, the HUD guidelines, ignoring users in the design process. We found when we spoke to the residents, they had really good ideas. Their ideas were not always expensive ideas. They were just really, really simple, good ideas. And then lack of connection between, like just knowing that the built environment and social health are connected. The environment can help. What is worse, you're stuck with the environment. So you really, really, really want to be careful and intentional about it. And that's where we'll wrap up. Again, the built environment can contribute to social connection. We're showing you with the data. Top 3 spaces: walking pathways, patios, community rooms, space to distance, space to get outside, ventilation. And then a few key things that we talked about where the HUD guidelines can actually be changed to prioritize. That's in your cheat sheet. We have to talk with Brian on how we get this into HUD's hands. We do have a connection with HUD right now, but we have a cheat sheet that says, here are all the features. Does it allow social connection? Does it allow safety? The ones you prioritize are the ones that do both. And then we say, where is the supporting evidence? Did it come from what your people said? Does it come from the literature? Does it come from the expert opinion? All of that is tracked. So that's the cheat sheet at the end. And then the next steps, hopefully, is, of course, sharing insights broader than just this group. Developing a safe social resilience audit every time you do a new building. Think about it. Is there social connection? Is it resilient social connection? Applying for grants. We've done this. We've actually used U of M students. They have done some really fun projects using this for design innovations that we will send forward. And then keep building coalitions, keep building partnerships. So really, really, really honored to start this work and hope we can keep it going. Thank you so much.